Have you ever wondered how vital it is to know CPR? Today let's delve into the crucial importance of learning cardiopulmonary resuscitation, or CPR as it's commonly known. It's a life-saving technique that's paramount in critical situations, such as sudden cardiac arrest, where every second counts. Statistical data shows that survival rates increase dramatically when CPR is performed immediately after cardiac arrest. In fact, studies have revealed that quick and effective CPR can double or even triple a person's chances of survival. But the applicability of CPR isn't limited to just medical facilities. It's a skill that's practical and can be used anywhere an emergency arises, at home, in the park, or at the shopping mall. CPR is not just a skill for medical professionals, it's a skill for everyone. So understanding and applying CPR can literally be a lifesaver. Let's unravel how you can do it. Before jumping into the steps of CPR, it's crucial to know when to use it. Knowing when to perform CPR can be the difference between life and death. It's not something you do on a whim. You need to be aware of the signs that indicate the need for CPR. Firstly, unconsciousness. If the person is unresponsive, not reacting to your voice or touch, they may require CPR. Secondly, irregular or no breathing. Are they gasping for air or not breathing at all? If so, CPR might be necessary. Lastly, check for a pulse. If there's no pulse, CPR is vital. Checking for these signs properly is essential. Gently shake the person and ask loudly if they're okay. Look for signs of breathing and feel for a pulse on the side of the neck. Remember, if these signs are present, call for medical help immediately. Every second counts. Now that you know when CPR is needed, it's time to understand how to perform it. Before performing CPR, a primary assessment is essential. This is the vital first step in determining the patient's condition and the appropriate response. To begin, check for responsiveness. Shake their shoulders gently and ask loudly, "Are you okay?" If you receive no response, it's time to call for help. Dial your local emergency number immediately. Next, check for normal breathing. Watch the chest rise and fall, and listen for any signs of breath. If breathing is absent or irregular, this is a clear indication that CPR may be needed. But don't forget to scan for severe bleeding too. Uncontrolled bleeding can be just as life-threatening as a stopped heart, and requires immediate attention. Each step of the primary assessment is equally important as they collectively provide a clearer picture of the victim's condition. They ensure that you can take the most appropriate action, giving the victim the best chance of survival. With the primary assessment done, you're now ready to start CPR. Now comes the crucial part, performing CPR. CPR, short for cardiopulmonary resuscitation, is a life-saving technique that helps maintain blood flow to the brain and heart in an emergency situation. It involves two main components, chest compressions and rescue breaths. Let's start with chest compressions. First, you need to position your hands correctly. Place the heel of one hand in the center of the person's chest, then place your other hand on top of the first. Interlock your fingers, ensuring that you're not applying pressure with your fingers, but with the heel of your hand. Now, it's time for the compressions. Push hard and push fast. You're aiming to compress the chest at least 2 inches deep. The rate should be between 100 to 120 compressions per minute. That's almost 2 compressions every second. And remember, allow the chest to fully recoil between compressions. Next, we have the rescue breaths. After 30 compressions, give 2 rescue breaths. To do this, first, tilt the person's head back slightly to open the airway. Pinch the person's nose shut, take a normal breath, cover the person's mouth with yours and blow until you see their chest rise. Then, give a second breath. If at any point you feel uncomfortable giving rescue breaths, or if you're unable to do so, don't worry. Just continue with chest compressions until help arrives. These steps of CPR should be repeated in cycles of 30 chest compressions and 2 rescue breaths. Carry on with this cycle until emergency help arrives or the person shows signs of life, like breathing. This might seem a lot to remember, especially in an emergency situation, but with practice and calmness, you'll be able to execute these steps effectively. Remember, proper execution of these steps can mean the difference between life and death. So, let's all make the effort to learn and master CPR. You never know when you might need to use it, and that knowledge could save someone's life. Let's quickly recap the steps to perform CPR. First, check for responsiveness and call for help. Next, perform a primary assessment by checking the breathing and pulse. If the person is unresponsive, begin chest compressions at a rate of 100 to 120 per minute. After every 30 compressions, give 2 rescue breaths. These steps are crucial in maintaining blood flow and oxygen supply during cardiac arrest. With these steps in mind, you're now equipped to save a life. Remember, the power to make a difference is in your hands.